students. Today we are going to talk on one of the most important principle. Basically, we are talking about the principle, not the technique actually. We must understand the principle on tension band wording. What is this? What is the principle over there? How it works? And how technically how you have to do that is another part. Basically, your understanding of your principle is more important. How the tensile force is being converted to a compressive force. So today we will be talking on the principle of tension band wording. Few examples you already know. The tensile force is a deforming force in the flexor. It is working a distinctive sort of force. So it doesn't allow the bone to come with the contact. Yes or no? So this is not a desired thing. So it is happening so. It is working against the process of your union. So your principle that bone should be in contact, good contact, in the time of your during the process of your healing. So you must maintain it. So the deforming force should be counteracted. Now, few examples. The whole principle behind is to how this deforming force could be converted to beneficiary force. Now, certain areas you must know in the bone. There's some. See. There is an example here. Some examples over there. They are supposing there is a flexor here. I am giving an example over there. In this area, particularly subtrochanteric joint, is a very good example. That is why I am giving this bone here. You will find that this part is concave, part is compressed, and this part is distensive one. Yes. So once the load is forming over there, the center rotation will be where? Center rotation will be in the medial side, this side. So if it is rotating there, it will be distracted here. So if load is falling on it, yes, then the center rotation will be working over here. This will lead to opening up the other side. Exactly. Now, same work in this technique. What is going to do? Can this load which is working over there, if you can shift this center rotation towards the convex side or tensile side, probably the same force could be act as a beneficiary force and a compressive force. Getting my point? Now how it can be done? So if I am having a flexor over there, this is the flexor over there. Necessarily because of this load deforming force, it will open up here. Center rotation is working over here. Two forces over here. Now if I am applying something over there, this side, in the tensile surface, then what will happen? This wall load which is falling, this center rotation will now shift to this implant here. Yes? So instead of this, the load will be the distensive force will be borne by these implants, and the center rotation will be shifted to this, and this force will now act as a compressive force. So this is the principle of your tension band wording. So it can be applied in the plate also. So in the plate, compression plate, ICP, dynamic compression plate, locking plate, what about manipulation plates, buttressing plate, all concepts are there. But in these situations, then applying something there, shifting the center rotations to the distracting force will necessarily help in converting the distracting force to a compressive force. That is what we have to do. So if you are applying something over there, you will find that it will go into compress. Now take the example of your follicle, the another area. See. So if commonly used technique. So commonly you apply one place is your follicle, another is your patella. Now how the deforming force is converted here? Okay, fine. Suppose this is the flexor over here. Okay, fine. So you have a muscle over the biceps. Yes or no? You have the muscle over the triceps. Humerus nine. So humerus is here. Yes or no? Humerus is here. Yes. Now, how the distracting force is working? So while you are doing the flexion and extension, they are integrated. change the center rotations towards the lateral side, towards the periphery, then this force can be converted to your compression force. Now what is happening if you are doing a tension maneuvering like this? So if you are fixing like this, this thing, then what happens? We have wire is also placed over there in a figure of A. Now this center rotation will be shifted to this side. Now the force which is working as a distracting force will be converted compression at the flexor side. So this is the principle. Yes, so this is the principle. Techniques are okay. We'll talk about technique. Plate is also a type of tension maneuvering if you are applying it that way. Because all plates are not working in same principle. Some are integration, some are tension. If you are applying in tension surface, same thing. Here radius also you can apply the radius dorsal convex surface. So that will be also as a tension maneuvering principle. Yes. So that is all the principle is. Now what are the prerequisites for it? Anybody who can tell me, can you do everywhere this principle? Again, tension band are two types. One is called static, another is called dynamic. So what is static or is dynamic? Static means it is remaining same during the that is not going to change during the movement. Another is where the moment you are applying over there, then it will exert more compression. Examples are this is a dynamic or static? Dynamic. So if you are doing movement there, then the movement will be again accelerating more compression at the flexor side. But if you are applying this principle there in medial malleolus, that can be also fixed. But this is the static type. Patella both. If you are doing movement, it will go for dynamic. If you are not giving movement, the giving movement it will go. Not giving movement is the static one. One more example is your in the trochanteric area. One can do. See few examples of your flexor is there. You can pass the pin over there like this. Then we make a hole like oligocon. Then you can fix it. Yes or no? This way one can do tension band wiring to your TBW color. Sorry, GT. That can be done. So same principle. But here also actually you are doing the abduction, that will be compression. Yes. So that is your two types. One is called dynamic type. One is called static type. Dynamic mostly while you are giving movement in the axis, that will act as more compressions. That is why it is called dynamic. Okay. So that is the basic principle. So this concept has come in 1928. A surgeon known as Pierre Mercer. Yes, something like that. So he has while giving load is converted. And these principles are actually architect engineering. So architect engineering actually they have actually shown us the part how one can do the tension band principle in architectural design. That all came out in. So this is the thing. One can make out here. There is suppose there are two tie beams up here, and this connecting tie beam you have a cap over here. So if you are giving load, there is nothing there, that will open up. Yes or no? It will distance. This go this way, it will this way. Now if you are binding this with another device over there, then if you are giving load, this center of gravity which is working over there for deforming one, now is shifted to this side. Now same principle, if you are a pressure, you will find almost it is exerting here. It is almost 5 times. If you are 20, it will be 100. So this principle actually covered architecture engineering being observed by surgeon 1928. Then is picked up, now it is being used. With modifications of this, your technical simplification of it. Now, let us take an example. Now, how you are going to do tension practically? This is principle. Anything to be asked to this point? Okay, if you have anything to be a principle part to be clear to you, then technically okay, technically. But this is the principle. Now, what technique you are applying depends on the surgeon also you can do it. Now, in case of oligocon fracture, suppose you are taking example of oligocon fracture. need to do for this fixation technique, tension band wiring? One, K wire. What is the size of the K wire? 1.6, 1.8. One. Number two, what about the wire? Stainless steel. What is the diameter? No. It is 1 mm diameter. 1 mm almost. It is 1 mm diameter. These are the two requirements. What additional thing you need? Reduction process. Drill bit, what is the size of the drill bit? 2 mm. Smaller. Because you do not need to do a big one. Now initially what we are doing, there is a fracture there. These are requirements. Then a plier, drill bits, and then a tightener, bender, and cutter. All these things will be needed. These are the requirements. So if you are going to do is these things must be with you. That is the principle. Okay. Now what is the technique? Opening, we are not going to do. Exposure, okay. Then what we are going to do? You are cleaning it. Now, one thing in the principle which I have not mentioned, nobody has raised the point also. What is the basic requirement for this? Can you apply this technique always? No. Tell me, what is the basic requirement? Concavity, kya?
Concave surface
Should what? Integrity. That is more important. See, if your fracture is there, if this part is comminuted, dangerous. It is going to fail. So you must have the integrity of the concave surface. Same principle is applicable here. So that is why in those situations probably you do not give dynamism. Static principle may going to work if it is stable. But here if you have to apply the dynamic principle of tension band wiring, you must have a good integrity of the concave surface. So if a loss of bone is there, comminution is there, it's not a good surface. Yes, sir? But there you can convert a static one. You can do it. There is nothing that you can do it. Anyway, that is one of the basic requirement to apply the principle of dynamic tension band wiring. Requirement. The same thing is applicable for petla also. Under surface, if there is integrity is not there, dynamisms lead to more displacement of failure. So, which is playing the important role for tension band wire or the pins? Where? This is where. More important. And then why you are giving the K wire then? Keep the fragments in position so that it doesn't get displaced. Basically, wire is playing the important role, not the pins. Pins are added to some, so even some certain they only doing only wiring, no pin. Then be done. But there is a possibility of displacement. So that is why you need to choose the pin. Okay, fine. Now, which thing you are going to do first? The pinning or the pin drilling? Drilling. Now, question arises: where to do drilling, and how much distance should be there for the flexor side? Anybody? We say that 2 more. Yes, from the flexor side, 1 point. What should be size? What is the size of drill bit? 2 mm. How much thickness should be there from the border? 1 mm minimum. So if you are very more towards the periphery, but it should be eccentrically. So you are shifting to the convex surface. So it should be eccentrically placed. Yes. So if you are going too much anteriorly, it's not going to serve the purpose. So it should be placed like this. Okay, sir? Okay. Drilling is done. We are doing drilling. Oh, Asif, you do drilling. Take a drill bit, small size. Small size drill bit. One drill bit is there. One drill bit. Okay, fine. Okay, first thing you are going to do a drilling. Yeah. So practically you have to do it. Okay, done. Yes, 1 point. There, what about this is 1. are going to pass the KVR. No, you pass the wire first. So if the KVR is already passed there, sometime this will come on the way of your wire. So where should we pass? Now pass the wire. What next? Put the wire. Oh, okay, wire. Pass it. Pass the KVR. Somebody, okay, pass it. Pass it. Then what you can do? You can take a size. Or you know that this pass I did. You can cut it away also. Yes, you can need that pass. Okay, you know it. Then you can cut it. One cutter is okay. Only. So this is one. Then you can make a loop also if you want. We'll talk about a loop later. What next? What next? Loop the KVR. Loop the KVR. What is inside of the KVR? 1.6, 1.8. Now what should be direction of the KVR? What should be direction of the KVR? In which direction is supposed to go? No question with that I do not know. Which direction is supposed to go? Is supposed to go towards the enter surface. Okay, and it is good to put it in enter surface rather than putting it in membrane cavity. So one can give the wire like this also, there is no harm. But this is not going to serve better than this. Your point should be going towards it. But while doing so, you have to be very careful also. What careful? If you are going too much anterior like this, you may also go through the articular surface. Yes. Yes or no? So if you are not sure, then you can take the help of CM also to see that I am not going through the joint. But your direction should be there in this axis. Okay? Sometime after reduction you do not know exactly where you are going. Okay? Now, is there any more technique? Suppose CM is not going to help you. Is there any more technique to know that we are actually away from the articular surface? What technique we can do? Flexion movement, okay, that is not good. What you can do? Then visualization, you distract it because the wires are parallel. Yes or no? Wires are parallel because you have to pass the wire parallel, not crossing. It should go parallel. Then you can open it up, you can see if you are not happy to make it sure that I am away from the articular surface. Otherwise, you may go through the articular surface. Okay, sir? Okay, fine. Then put a wire over. Put a wire. Put. What direction is supposed to go? Yes, this direction. Okay. Pass the KVR. Pass in. Reduction is done and you put it KVR like this. Yes. Yes. Go. If necessary, you can take a bononic also. If you are now up to what extent you supposed to go? Tell me, up to what extent is supposed to go? You should cross it. Why it is necessary? It is necessary that at the final sitting, you need to hammer it. So if you are unable to pierce the cortex beforehand, you are not going to. The hammering may lead to bending here. So you pass it, and then once, how do you know you are passing it? The resistance which is there at the time of drilling will be suddenly off. You know that I am crossing. Go up to that. Go. Cross it. Resistance is supposed to be there. In anticortex, it is coming out. Go. So see, it is coming out. Okay? Yes or no, it is coming out. Once it is coming out, you try to withdraw a little bit. So that you know that I am doing this. After bending, if I hammer it, you will go up to that. So you have a calculation in your mind that I am withdrawing this one. Withdraw something. Withdraw. Okay. Withdraw. Achha. After withdraw, you know that I have withdrawn this pass. So finally, while you are doing the bending and other things and hammering it, sitting, then you know that I am extending after that. Not beyond that. If you are going too much, it may cause other things also damage. It is a servant. Okay, fine. Go for next one. खोलो नहीं इसको खोलो. Take the other thing. Yeah, okay. Next one. Another one should be go parallel to it. Take the help of this. Go along with this pin. Go. फर्स्ट ईयर लोग कहाँ है उसको बुलाना है इनको ये एक्चुअली क्लासेस लेने पड़ते हैं होगा कहो होगा ठीक है ओके now additional part you can know that I do not need this thing you can cut it here cut it yourself जाओ you take the help of them इसको भी काटो इसमें एक्चुअली गाइड रहता है एक्चुअली ये पॉइंट भी रहता है वन कैन काटो दिस काटो एंड अनदर वन ओके फाइन then this part is over now you need to do a loop okay fine so there are two loops techniques one is double loop technique one is single loop technique. Double technique means you can additionally then make a loop over here. How to make it? Other process you can take or anything something like that. You can see there are two techniques. One this is conventionally used. This is what I am doing. Conventionally used. But one can have a additional loop at the level of flexor at both sides. So one loop is you can additionally bend. Here you can bend a loop and make a loop and giving tightening over there. Are you getting my point? You can do a loop like this. This side. Another is your at the other side. It is this. Yes, both the things simultaneously go compressive. Understood? Okay? Yes or no? Yes, one can do tightening over there, one can do tightening over there, they will give a good compression. So you can do it. You can do it here, I am giving a loop. And if you do it simultaneously both sides, then it will give more benefit to it. Yes? Okay, pull it here. Now you can see this part tightening is also coiling is also important. How to do it best? Plier is here, now I will show you. There are few techniques are there where there are various techniques people used to do individually holding like this. Now why it is important? See, I will show you another technique here, another thing here. This can be sacrificed. See, this is one. How to make a coil? This concept is called helical. You know the helical technique. So one thing is they are wrapping over here. See, I am tightening it. But what when if you are giving too much pull over there, not equally falling, how it is going to react? It will react. It is if you are pulling too much here, or you are pulling too much here, not equally falling. It is loose, but it is very tight. What is going to happen? So it will rotate like this. See the loop. So this loop is ideal, not ideal. Not ideal. So if you tight it, you will find it will slip. So this is not going to work. But if you are sure that you are doing so, it doesn't mean that you are going to lock it. Got my point? This is also important thing you should understand. That I am pulling, I am giving a rotation, it is fixed and it is helically it is going up. So it is not going to give a good look. So this is not ideal. Ideally that simultaneous mode. How you can do it? Okay, I will show you a technique by which one can convert it to better way. Supposing this is the thing. Okay, put it like that. is happening here? You are happening that you can give a pull also. Then this pull, this is never going to slip. If you are holding in such a way, it's never going to slip. Is it possible? Certainly no. I can give a pull. This pull is going to help you more compression here. This pull, see. Two things I can do thermodynamics. I can pull it nicely, so we can give additional. This pull. Just hold it tightly. Hold it tightly. Then I am rotating it like this. Now look at your coil. How it is rotating. So it is never going to slip. See the uniform. At a time you know that how much you are going to tighten. Oh, it is enough. So what is one of the best way to do tightening of the wire. So it is a nice looking locking. But this is not nice. Okay, fine. So this is one of the simple technique. Okay. Now this is over. Okay, fine. Now next point is then what it is okay. We are doing so. We have tightening. How you are tightening? We are showing. We can do it simultaneously both sides, so that it will need more exertions of the compression there. Now how to bend this pin? There are various concepts. People used to hold it like this. See, if I am holding it like this, I am bending it. What I am going to do? Actually, I am levering on the bone. I am taking the help of the bone to bend it. So thereby, what I bend, the bone is soft one. It may go away. Get my point? So I am showing a technique by which one can do it. So the simplest way technique is that if you put this hole like this, now your bending force, you mind it, you do not lever on the bone, but lever on the bone, metal itself. Yeah. So if you are bending it like this here, see, you can do a nice bending over here, and it's not going to slip. Are you happy with this bend? So next time you are going to rotate it like this and hammer it. So bending can be done. It is easily with this hole. Do not lever on the bone, but the leverage should be forced. Deforming force. It is like this. You can put it like this. Put it like this, and you can bend it over the metal, not on the bone. Then you can have a very good look. This is all. Okay. Supposing if it is very powerful, it is not one. Sometimes part of the one part was cut na. So if you do not have this technique, another technique to bend it, hold it. So another technique is that one can put this cover in between these two. Okay. Now I can bend in another way. So suppose if you in this very big one and you are finding it difficulty, you can bend to some extent with this technique also. I am keeping it here. So if I am forcefully putting it like this, how is it bend? Okay. So unnecessarily you are struggling here without even having control, because many times slip people. Yes or no? This is practically happening. Yeah, I cannot bend. And if you are bending also, you are levering on the board. So there are very simple way to do it. It's bending is also not bad. So you can do a bending from here. You can do. So but rest of the job, see, you cut it the defined way and push it. Then give the exercise. Okay. So this is in the actually technique. And previous earlier part was the principle. The earlier part, how this principle of tension band works, where to put the tension band, what are the basic requirements to it, and this part is your technique. How exactly you are exerting this principle in the practical field. This is your technique. So anything to be asked, anything to be clear, and one particularly first year student, they should do it yourself. So this bone lab is actually meant for the first year students. They should have developed the technique, how to drilling, how you have a control over the drill, how you are doing to holding. Because this thing you cannot practice over a living man. You should develop the technique by yourself in this bone lab. So this is the principle actually. The concept of this is to do on yourself. All these things are made available once you try it. Try yourself here instead of going live. So thereby sometimes if you are misplacing, you may do damage also if you do not have it. Because these are all technical, and even tactile sensation and the orientation of your brain and the holding, that should be developed here. That is why it is called skill lab. You develop this skill here about the unwanted incidents also. Yes? So this is why this concept is being introduced, and you should understand the importance of it. Any question to be asked or anything to be clarified on this principle?
Sir, suppose we have taken large amount of K-wire, either K-wire of the thing, and we should bend it after hammering to the fixture side, or we should bend
No. If you are bending it, then how are you going to put it? If you are long bending, you are doing the bending, then if you are hammering it, how the rest of the you are going to in? So you are bending it to push it inside the tendon. They have the bone. Why you are hammering? Before hammering also one should make a link over the tendon, like your quadriceps. So you should make an incision so that it goes inside. Yes. So while you are usually I see, you will notice that I did a looping on this side, actually bending this side. Finally, what I did, I tried to do it like this, rotate it. Now, what you are doing, at this moment of time, you are on the triceps. You are on the triceps. Now, make an incision over there. Now, you push it here inside. So, it is going inside on the bone. So, you have to have a very ideal length of this shape. If you are keeping it very long, it will unnecessarily cause more damage. So, that should be proper one. Yes. Any question? Anything to be clarified? If no, এটা আমাৰ ছাৰ আহিছে, ছাৰৰ লগত ইন্ট্ৰডিউচ কৰে. Thank you.